Good morning, everyone. My name is Molly Clayton, and I serve as the Executive Director for the Texas Campaign to Prevent Teen Pregnancy. Thank you for joining us this morning for a webinar outlining policy priorities for the 86th Texas Legislature, which just kicked off earlier this week. Before we get into the content of our discussion about the legislative session, I wanted to share a few tips for using the webinar platform and a bit of background information about our organization. First, we have muted all participants to help reduce background noise, but we welcome your participation and questions using the Q&A function you see at the bottom of your screen. If you have a question for one of our presenters, please submit it using that tool. We will have time for questions at the end of the webinar. Also, we will email a PDF version of the slides to all participants following the webinar. And we are recording and will post the webinar on our website at www.txcampaign.org. And finally, the Texas Campaign relies on data to inform our work in policy, programming, and operations. We ask that you help us continually improve the tools and resources we provide by sharing valuable feedback through a short poll at the end of the webinar. Again, I want to extend a warm welcome to all of our partners and colleagues across the state. Many of the names on the registration list for today's webinar were familiar, but for those who may be engaging with us for the first time, the Texas Campaign to Prevent Teen Pregnancy is a statewide, nonpartisan, nonprofit organization dedicated to reducing teen pregnancy through research and data dissemination, advocacy for effective public policies, strategic collaborations, and training and events. As a statewide systems changer, our primary audiences are comprised of stakeholders across the state whose decisions and efforts impact the ability of Texas adolescents to access the knowledge and healthcare resources they need to make informed decisions about their health and reproductive futures. We have the privilege of working with healthcare providers, educators, social workers, researchers, coalitions, community organizations, elected officials, philanthropists, and others. We were founded in 2009, so as we turn 10 years old this year, we look forward to continuing to work closely with our partners across the state to champion data-driven decisions around policy and practice to support adolescent reproductive health and the prevention of teen pregnancy. As a small and mighty organization with statewide reach, we will be leveraging the power of webinar technology in 2019 to engage communities across the state. This is the first of several webinars we will host this year on a range of topics related to teen pregnancy prevention policy and strategies. On the webinar today, I will share a brief overview of our goals for the 86th legislative session. Then we will be joined by our new board chair, Dr. Moss Hampton, Chair of the Department of Obstetrics and Gynecology at the Texas Tech University Health Sciences Center at the Permian Basin. Dr. Hampton has been a longtime advocate for women's reproductive health through his involvement and leadership with many organizations, including the American College of Obstetrics and Gynecology, or ACOG, the Texas Medical Association, and the Women's Health Advisory Committee. There are many factors which influence effective advocacy, and Dr. Hampton will share his perspective on the current legislative and political landscape of our beloved Lone Star State. And next, after that, the Texas Campaign's policy and data analyst, Jen Biondo, will share more details about our policy priorities and opportunities this session. Jen spent 5 years serving on the Legislative Budget Board, most recently on the Article 2 Health and Human Services team, and we're lucky to have her expertise. Finally, we will wrap up with ways that you can take action and be an effective advocate this session. At the Texas Campaign, we look for opportunities for improvement in public policy through legislation, regulation, and implementation. The Texas Legislature only meets every other year for 140 days, which means that opportunities to change policy through state statute is relatively limited compared with most other states. This legislative session just kicked off on Tuesday, so over the next 138 days, we will be supporting policies which increase adolescent access to information and healthcare resources to prevent unintended pregnancy, with an eye toward proposals which are politically viable in our current legislative climate and which leverage the collective wisdom of our partners working directly with adolescents across the state. Things tend to change very quickly during session, so we will be sending periodic updates on progress and developments to our listserv. We encourage you to sign up for these updates if you have not done so already by going to the Policy and Advocacy section of our website and clicking on Take Action. We will host another webinar this summer to wrap up the legislative session, so stay tuned for more details on that in the coming months. And now I will turn it over to Dr. Moss Hampton to share some background on the context and climate of the 86th Texas Legislature.
Well, thank you. Thank you very much, Molly. It's a pleasure to be on the webinar today, and I'd like to welcome everybody who's listening in. This is our initial efforts to increase the advocacy role of the Texas Campaign to Prevent Teen Pregnancy. And so we're all excited about our new venture here. I've been asked to kind of give a update on the state of the 2019 Texas Legislature. That's always done with fear and trepidation. I'm sure if anybody, or I'm sure several of you out there have been through legislative sessions before, and you know how much fun they are and how much excitement can be generated and how crazy it can get, particularly on day 30 to day 0 when the fun really starts. But anyway, I think there's a lot of reason to be hopeful this session. I think that we have a lot of new players in the game, primarily being a new Speaker of the House. That is a very powerful position, as we all know, and certainly one with a lot of influence. The new Speaker has been relatively quiet so far, but I'm sure there will be opportunities to see how he will react in the coming days. In addition to that, we have more Democrats within both the House and the Senate. And while they do not have a majority in either legislative branch, certainly they do add a new dynamic to the way that the legislature will act. And it'll be interesting to see if they have more say in what has been going on than previous legislative sessions. I think that a lot of the opportunities that have developed this session are the result of all of the attention that Texas has received for our maternal morbidity and mortality rates. Certainly this has gotten everybody's attention. I think that everybody is duly concerned about the high number, or how we compare with other states in our country and how our country compares to the other nations of the world. So I think that at least for now, the environment seems to be very accepting of some of the ideas that we have talked about or presented. I've actually heard the term or phrase expanding Medicaid coverage said out loud and in public, which I think is a real step forward. There's a lot of support, I think, for auto-enrollment within the Medicaid system and the Healthy Texas Women's Program. And so all of these things I think, are very positive. I'm sure that there are issues that will come up that could cause the pendulum to swing the other way. But hopefully we can navigate that without too much trouble. As everyone knows, the real challenge of the legislature is related to funding. And this year we have the good fortune of having extra funding available, or at least that's been the initial report from Austin. Certainly our increased revenues are driven by the increase in the population of the state of Texas, which has caused the sales tax revenue to go up. And also the activity of the oil and gas industry and the success that they've had over the last 2 to 3 years has also helped to increase the state revenues by about 9% overall. So there's extra money that's out there that will be available for Medicaid. and for the legislature to divvy up. Just as we are all aware of the women's health care side of things, there are other competing interests such as school financing, property taxes, community health needs, increasing Medicaid payment to providers, hurricane and disaster relief funds, the rainy day fund. All of these issues will come up, and all of these entities will want to be part of the funding formula and could affect what we can and can't do on the women's health front. Just to give a short recap of kind of where we've come, as everybody will recall, in 2011, the women's health care services were devastated because of the lack of funding, and we really went to ground zero there. That was, I think, a very tough position for all of us during that time. Following that, Jane Nelson was kind of the hero of women's health and brought back the women's health care program. We got that started. After that, they came back and cut funding to Planned Parenthood and Title X. We've worked through that to a certain degree, although not to everybody's satisfaction. Last session, the Women's Healthy Texas Women's Program got started and has faced the challenges of a new state program, but seems to be coming out, I think, on the positive side of the ledger. Just as we've heard recently, Leslie French has stepped down from the head of that position, and we'll have to see how things run without Leslie. She was a great friend to us and to the program, I think, and she will be missed. We've seen the Texas Women's Healthcare Coalition develop and thrive. I think this has been a tremendous organization. The fact that everybody that has an interest in women's health can get together and talk about our issues, our concerns, and really develop a coordinated plan has been very helpful in our lobbying and advocacy efforts. And I look forward to another successful legislative session working with the Women's Healthcare Coalition. I think of the bills that are out there that are very positive for us. There seems to be a lot of interest in auto-enrollment, so that as pregnant women deliver and then move out of Medicaid, then they can be auto-enrolled into the Healthy Texas Women's Program. This was a key part of the Healthy Texas Women. They've had some stumbles along the way, but there seems to be a lot of effort going into making that happen, particularly as younger women roll out of the CHIP program and pregnant ladies Medicaid. So a lot of interest there. There's been, as I mentioned earlier, a lot of interest in expanding Medicaid coverage for postpartum. The postpartum period now is 6 weeks. Is 6 weeks, but there's been effort to expand that to a year. And again, this is related to the maternal morbidity and mortality crisis. So we have that. We have a lot of interest in trying to expand the use of long-acting reversible contraceptives, and there seems to be a lot of support for that. There's also a bill to make it feasible or make it possible for Medicaid women to have payment for transportation and include their children so that they can hopefully make their appointments. So I'm going to stop there and turn it back over to Jen, but as I say, I think so far I'm optimistic about the upcoming legislative session, and hopefully we have a great deal of success. So Jen, turn it back to you. Thank you.
Well, Dr. Hampton, thank you so much for that great overview, and thank you so much for all of the work that you've done on behalf of Texas women. We appreciate it.
Thank you.
So I am Jennifer Biendo. I'm the policy and data analyst for the Texas campaign, and I am so glad to see that so many partners were able to join us today. We have great participation in this webinar, so thank you for being here. So next, we are going to look at some of the specific public policy priorities that the Texas campaign will be supporting in the legislative session. Our hope is that this session will bring in a spirit of bipartisanship and allow broad coalitions to work towards policies that allow Texas youth to make informed decisions about their futures and provide access to desired reproductive health care. So our first policy priority would allow teens who are readier parents to consent to their own contraception. So we know that one of the clearest risk factors for a future teen pregnancy is actually a prior teen pregnancy. We know that teen parents can be resilient. They can complete their education, they can form strong workforce attachments, achieve their life goals, and be great parents. But we know that all of this becomes more difficult with multiple unintended births. So this policy change is intended to empower teen parents to take charge of their reproductive health and ultimately reduce the rate of repeat teen pregnancy. The Texas laws that govern the ability of a minor to consent to health care, including reproductive health care, are among the most complex, the most confusing, and the most restrictive in the nation. Under Texas law, teen parents are the decision makers for their children. They can consent to all of their child's medical care. However, under Texas state law, teen mothers under the age of 18 usually cannot consent to their own prescription contraception. So we have a real disconnect here in our current state law. In our society, many people share a belief that we have these certain milestones that confer the ability to make adult decisions. So these are things like marriage, military service, and also parenthood. So in fact, under Texas law, youth under the age of 18 who are married or who serve in the military do gain the legal right to make many of their own healthcare decisions. But we don't extend that right to teen parents, even though they're making all of these important decisions for their own children. Most other states recognize that it's in the best interest of youth and society for teen parents to be able to easily access birth control. So even in states that usually require parental consent to contraception, most of these states waive that requirement for teen parents. In fact, Texas is one of just 14 states that does not allow teen parents to access birth control without the consent of their own parent or guardian. So Texas teens can access contraception at clinics that are funded through the federal Title X funding stream. However, many teens are unaware of this, and in a state as large as Texas, we also have regions throughout the state that lack Title X coverage. Additionally, Title X clinics don't always accept Medicaid, which covers many teen parents. Under interpretation of federal law, teens on Medicaid can consent to their own contraception, but this provision is not well known by teens and also by many providers. So ultimately, all of these contradictory state and federal laws are confusing to providers and patients and make it harder for teen parents to access contraception. So let's look at a little bit of the data around repeat teen births. So Texas has one of the highest incidences of repeat teen births in the nation. In 2017, there were about 27,000 total teen births in Texas to girls aged 15 to 19. Of those, more than 5,100 were not the teen's first birth. So in other words, 19% of Texas teen births in 2017 were a repeat birth. Additionally, a large percent of these repeat teen births were described by the teens themselves as being unintentional or accidental. So note that these data only describe actual births because the data are pulled from birth certificates. So that means that our repeat teen pregnancy rate is even higher than 19%. So we know that one very effective way to empower young mothers to avoid an unintentional repeat pregnancy is by enabling her to access highly effective contraception, such as an IUD or a contraceptive implant. And we refer to this as long-acting reversible contraception, or LARC. So LARC methods last between 3 to 12 years, depending on method, and they have extremely low failure rates. Of course, all birth control methods can have side effects, and no method is right for everybody, but research shows that teens tend to have, on average, very high levels of user satisfaction with LARC methods and high continuation rates. We also have very strong guidance that LARC methods are appropriate for teens and for women who have not had a baby before. However, teens can have trouble accessing LARC methods for a variety of reasons. So for teen parents, a LARC method is often offered at a postpartum visit, but we know that many new mothers, and especially many new teen mothers, do not manage to attend their postpartum appointment for one reason or another. So one emerging and very promising practice involves offering a LARC method either immediately after delivery, which is called a medium postpartum LARC, or during the hospital stay. However, obtaining parental consent can be a barrier to postpartum LARC. Interestingly, we hear from providers that it's not necessarily that the parents or guardians of these teens actually oppose the teen accessing birth control, just that they may not be present at the appointment to give consent. So now let's take a look at some of the specific policy work around this issue. Most state laws that govern a minor's access to healthcare are located in Chapter 32 of the Family Code. So any prospective legislation would typically involve adding a provision to the Family Code, noting that a teen who has already given birth may provide consent to contraception. So in the last legislative session, we made some really great progress on this policy priority. We had several similar bills filed on the topic, and the most successful of these was HB 1373, which was filed by Houston Representative Sarah Davis, who is a Republican and who has been a really strong champion of women's healthcare. We're very grateful that we have her in the legislature. HB 1373 was successfully passed out of the State Affairs Committee. However, after making it out of committee, this bill and many other good bills died in the logjam created by the opposition to the bathroom bill. That's the day that many of you may remember. So HB 1373 saw some really good bipartisan support last session, and we are hopeful that similar legislation has real potential in this current session. So currently we have SB 149 filed by Senator Rodriguez of El Paso, and we also have a bill draft that we anticipate will be filed shortly by Representative Davis on the House side. A note about SB 149 by Rodriguez. This bill is interesting because it also includes a provision that would allow teen mothers to consent to postpartum care. So under current law, pregnant minors can consent to prenatal care and delivery care, but in kind of a glitch in state statute, they aren't actually allowed to consent to their own postpartum care. And of course, we know how important postpartum care is for maternal health and preventing maternal mortality. So now we're going to move on to our next policy priority, but if you have any questions on this minor consent to contraception issue, please feel free to type in your questions using the Q&A button on the bottom of your screen, and we will answer questions at the end of the webinar. Sorry about that. All right, so our next policy priority is aimed at making sure that Texas youth can seamlessly access reproductive health care in the Healthy Texas Women program. So this policy priority is shared by a large number of stakeholders, many of whom are participating on this webinar today. So thank you for being here. And it's also garnering some really great bipartisan support. So we're hopeful that working together, this is a real possibility this session. So let's look at a little bit of data around teen birth in Texas. So when we think of teen birth, we often think of younger teens, like the show 16 and Pregnant, but actually 42% of teen births in Texas were to 19-year-olds last year. So that's nearly 11,600 births to 19-year-olds in 2017 alone. Some of these births to older teens can be intentional or planned pregnancies or desired pregnancies, but we know that a large majority are unintentional. So at the age of 19, most of these youth have aged out of Children's Medicaid or the Children's Health Insurance Program. And of course, without Medicaid expansion in Texas, this age group has an extremely high rate of not having other health insurance coverage. So additionally, we have some very robust and recent research from the UT Population Research Center showing that a high percentage of young women in this age group report that they want to be using long-acting, highly effective contraception like the IUD or implant. However, they perceive cost as an insurmountable barrier to the birth control method that they desire. So frequently, these young women are eligible for free or heavily subsidized coverage through a variety of programs, but they aren't aware that they're eligible, or they just don't know that these programs exist. So one of these programs is Healthy Texas Women, which provides reproductive health care and also some other basic preventative health care to low to moderate income women. Now, ideally, all Texans would have full health insurance coverage, and many of you participating in the webinar today are fighting on that very issue. But in the meantime, one incremental step is expanding access to reproductive health care. So let's go into just a little bit of detail about the Healthy Texas Women program. So this is a state-funded program that evolved out of the Medicaid Women's Health Program. And it provides a variety of benefits, such as contraception, well women care, STI screening and treatment for some conditions like diabetes and hypertension, and a few other services. So program eligibility is open to women age 15 to 44. However, we should note that girls age 15 to 18 who are financially eligible for this program are also eligible for full health insurance coverage through CHIP or Medicaid. So really, they shouldn't be enrolling in Healthy Texas Women. They should be getting that full health insurance coverage through CHIP or Children's Medicaid. Participants cannot have any other insurance. They have to be citizens or certain categories of legal residents. And they have to have an income up to 200% of the federal poverty level. So that translates to approximately $25,000 for an individual, or approximately $50,000 for a family of four. And then women who don't meet this eligibility may be able to access similar services through a separate program called family planning. And the family planning program is also open to men and to non-citizens and a few other people who aren't eligible for Healthy Texas Women. So the Healthy Texas Women program does not allow some of our largest family planning providers in Texas to participate. However, the provider base is still relatively robust, and most Texas counties do have at least one provider. Currently, more than 250,000 women are enrolled in the Healthy Texas Women program, which is actually more women that were enrolled in the Medicaid Women's Health Program at its peak. However, we know that not all women enrolled in Healthy Texas Women are actually accessing services. So one major factor in the growth of Healthy Texas Women, which you can see in this chart on the top right-hand corner of the screen, is the fact that women are automatically enrolled into Healthy Texas Women as they roll off of pregnant women's Medicaid. And so this is really important because it streamlines access to this program in a critical way. And so similarly, we could auto-enroll young women into Healthy Texas Women as they age out of CHIP or Children's Medicaid on their 19th birthday. And this would provide seamless coverage to reproductive health care. All right, so the concept of auto-enrollment got some very good traction last session. Senator Boris Miles, who is a Houston Democrat, filed legislation that was not successful, but Representative Sarah Davis's office was instrumental in getting a rider into the Health and Human Services Commission bill pattern, and that rider directed the agency to study the cost impact of auto-enrollment. So HHSC did issue that rider report in 2018, and it found significant cost savings associated with auto-enrolling young women from these children's health programs into Healthy Texas Women due to averting unintended pregnancies. In fact, the report found that the auto-enrollment would result in cost savings of more than $58 million in general revenue over a 5-year time period. Now, some of you may be familiar with the waiver application that is currently pending with the federal government that would allow Texas to turn the Healthy Texas Women program back into a Medicaid program and receive federal funding, even though Texas does not allow abortion affiliates to participate in the program. So that waiver is still pending and has been for quite some time. So in the event that the waiver is not approved, the cost savings associated with auto-enrollment would be much smaller. So based on some of the assumptions that we see in the Rider report, we would expect to see some relatively small cost in the first years as auto-enrollment is implemented, and then later that would shift to the expectation of some relatively small cost savings. However, regardless of cost or savings, this auto-enrollment would be so important in making sure that Texans have access to the healthcare that they want and need. So minor consent and auto-enrollment will be our two primary policy focuses in this session. However, we will also support the appropriations process for women's health programs that serve adolescent populations. So I'd like to give a shout out here to our partners with the Texas Women's Healthcare Coalition, of which the Texas Campaign is a member. And the coalition in recent sessions has been such a strong champion for funding for women's healthcare programs. And we so appreciate their work, and we look forward to supporting them this session around the appropriations process. So let's just do a quick overview of funding for women's health programs in Texas. So in the last session, 3 separate women's health programs, including Healthy Texas Women, family planning, and then also Medicaid for breast and cervical cancer, were all consolidated into one budget strategy in the HHSC bill pattern. So they're all now in strategy D11. And so it's really nice having them all consolidated into one budget strategy because we can easily track funding over time. Prior to that, they were kind of scattered throughout the budget, and it was very hard to see changes. So for the 2018-2019 budget, which we are currently in, the state budgeted $203 million in general revenue and $79 million in federal funds for the biennium. So that was $282 million in the biennium for all funds, or about $141 million annually. Now, in writing the budget, the state did assume that we would have federal funds for the Healthy Texas Women program in 2019, but that has not yet happened, and the state has had to go back in and fill in with general revenue. So the HHSC appropriations request for the upcoming 2020-2021 budget, in that the agency has requested level GR funding and then $22 million in federal funds. And that $22 million in federal funds is primarily for that Medicaid for breast and cervical cancer program. So interestingly, we also have a $1 exceptional item placeholder, which we assume will be better fleshed out as we get a better idea of what is happening with that Medicaid waiver request. So ultimately, what we hope is to ensure that the state builds in enough funding to accommodate expected caseload growth in the Healthy Texas Women program, and also hopefully to fill in some of the unmet need in the family planning program. So let's take a quick look at some of the other policy priorities that we will be supporting this session as we are able to. So beyond the items already listed, we are also tracking other proposed legislation. So one interesting bill is HB 30 by Representative Gina Hinojosa, and that would allow the transfer of unused LARC products purchased through the Medicaid and Healthy Texas Women program. So currently, if a LARC device is purchased for a woman who does not show up for an appointment, providers are not able to transfer that device to another patient. So it's just some kind of excess red tape for providers, and this could improve access to same-day LARC, which we know is so important. So additionally, the Texas Campaign generally supports bills that would improve the quality of sexual health education offered by Texas school districts. So currently, about 60% of Texas school districts offer abstinence-only education, 25% of school districts offer no sex ed at all, and only about 17% of school districts offer what we call abstinence plus education, which posits abstinence as the safest choice for youth, but also includes a variety of useful and medically accurate information on topics such as contraception. So additionally, we hope to lend a voice in support of policies that would help youth in conservatorship. So that could include supports for pregnant or parenting foster youth, pregnancy prevention efforts, and better data collection. There are a lot of very dedicated folks across Texas who do work on behalf of foster youth, so we look forward to supporting them and providing backup as we're able. So many partners, including people who are participating today, are supportive of bills that would expand full Medicaid coverage to 1 year postpartum. And so this is important, especially because it could really improve maternal health, both physical and mental health, and reduce maternal mortality. Many of our 19-year-old teen mothers are served by Pregnant Women's Medicaid, so this would be a very important provision for that adolescent population. And then finally, like Dr. Hampton mentioned earlier, we are supportive of bills that would allow the children of Medicaid patients to accompany their mother on funded medical transportation to prenatal or postpartum visits. So these visits are critical for maternal health, but we know that mothers might not be able to attend the visits if they don't have childcare and if their children cannot accompany them on the medical transport. And we want to remove barriers to accessing this important care. And there have been several bills filed on this as well. So that is a word on our policy priorities for the session. Please feel free to type in any questions in the Q&A box. And I will now turn it back over to our director, Molly Clayton.
Thank you so much, Jen, for that deep dive into our policy priorities this session. As you can tell, Jen is very well versed in the granular detail of public policy, and we're excited to have her engaged and involved this session. As she mentioned, in a moment we'll have time for questions, so feel free to send those along using the Q&A tool. And now that you've heard a little bit about our public policy priorities for the session, we hope that you will all join the effort to advocate for these policies that will effectively reduce teen pregnancy rates in Texas. The Take Action page of our website, found at www.txcampaign.org/act, has links to several ways to stay involved. You can see what's on our legislative watch. So this is a bill tracking page that will be constantly updated with bills that may impact teen pregnancy rates in Texas. It includes a link to a downloadable PDF of our 2019 legislative agenda in case you're looking for a snapshot on what you've heard today. You can also sign up to receive updates, as I mentioned earlier. If you're not already on our distribution list, this page has a link to sign up for regular updates on relevant policy developments throughout the session. Next, you can call or write your representatives. We have a link to find out who represents you at all levels of government to share your views on teen pregnancy prevention. And finally, donate. We could not do this important work without the financial support of advocates, community leaders, and philanthropists across the state. We truly appreciate any and all contributions to support our advocacy efforts. Another opportunity to learn and network with others in the field is our 8th annual symposium coming up on April 15th to 16th here in Austin. We have a great lineup of keynotes, workshops, and exhibits in the works. Registration is open at www.txsymposium.org, and we hope to see you all there. So now we'd like to open up the webinar for questions. As a reminder, you can use the Q&A button on the bottom of your screen to ask questions. We do have one question from Eleni Pacheco asking, do y'all have a compiled list of the districts that do and don't offer abstinence plus education? And do you have a list of the schools themselves that are and are not implementing?
So this is Jennifer Biendo, and I can take that question. And the answer is, I dearly wish that we had that list. That would be extremely helpful in our work. Unfortunately, in Texas, there is not one central location where that information is compiled. So to find out what districts are or are not offering, you actually have to go back to each district and ask them. So we have more than 1,000 school districts in Texas, so that is a complex proposition. But it's not all bad news. Fortunately, the Texas Freedom Network and Dr. David Wiley, who is actually one of our board members and Texas Campaign founder, have put out 2 excellent research studies. The first is called Just Say Don't Know, and the second is an update on that report called Conspiracy of Silence. And that report did survey school districts And that's where we get the data that only 17% of school districts offer abstinence plus education. So the good news is that even though only 17% of districts offer abstinence plus, we do know that a large number of the largest school districts, so the ones that you see in Houston, Dallas, Austin, San Antonio, many of those districts are actually providing very high quality sex ed. So the total percent of Texas students who are getting abstinence plus sex ed is much higher than 17%. And so these reports are all available on the Texas Freedom Network website. And if you're interested in the topic of school-based sex ed in Texas, I would highly, highly recommend taking a moment to read those.
The other thing that we should mention is the State Board of Education is going to be reviewing the Texas Essential Knowledge and Skills around health education this summer. And so we're working closely with our colleagues at the Texas Freedom Network to monitor progress on those considerations and revisions. And so we'll be engaging in that way as well. I don't currently see any other questions. I'm going to give it another minute or two. Again, we would want to say thank you all so much for being with us this morning, and we hope that you'll stay tuned for information on another webinar that we'll have in June to wrap up the legislative session. You can see our contact information on the screen if you have additional questions following the webinar today. As a reminder, we'll make slides available to everyone via email, and we ask that you please complete the quick poll that will launch momentarily to share your feedback. I see no further questions. And so thanks again, everyone. We're going to conclude the webinar. Have a wonderful day, and thanks for your support of Texas Teens.